Hi everyone, it's my pleasure and honor to have Dr. Hundal, the director and founder of Mission Valley Eye Medical Center, located in Fremont. Dr. Hundal, welcome to the show.
Thank you, Gupta.
Dr. Hundal, you've been practicing ophthalmology in Fremont, correct?
Correct, yes.
So what is the difference between ophthalmology and an optometrist?
Well, an optometrist is not a medical doctor. They are well trained to examine eye conditions, treat basic eye diseases, but they haven't gone to medical school. An ophthalmologist is a medical doctor who then specializes in eye disease and eye surgery. So it's a much more prolonged educational background that ophthalmologists have.
And over the years, being located in Fremont, how has your practice evolved?
Dramatically. When I moved to Fremont, my practice was primarily non-Indian.
Okay.
And over the last about 20 years, it has become predominantly Indian as the populations have changed significantly in Fremont from almost 5,000 Indians to about 40,000 Indians. So has my practice. It's evolved with that,
Wonderful. What are some of the common vision problems you see? Things that, the general public can come and talk to you about?
Anywhere from the younger patient, let's take a teenager, whose problem may be basic like nearsightedness or astigmatism or farsightedness, to the day-to-day mundane issues of itchy eyes, scratchy eyes, pink eye, red eyes, to bigger conditions as the population ages in the 50s and 60s. You're talking about cataracts, glaucomas, diabetic eye disease, and macular degeneration.
Okay. What would you say is the most serious disease that affects the eye?
I would say one of the most difficult diseases that we deal with is macular degeneration. It's an aging condition of the eye. And of course also conditions like glaucoma, which is also generally undetected in early stages and can do irreparable damage to the eye.
Can you explain and describe what cataracts are, and how does a normal person, if they're going about in their 40s and 50s, when they start to have symptoms of the disease, are they noticing symptoms?
See, cataract is perhaps the most common major eye illness that afflicts people in their older age, typically 60-something.
Okay.
Most of the time the patient has no symptoms in the early part of the disease, but as it progresses, the vision gets more blurred. It's harder to see at night when you drive, there's a lot of glare, there's difficulty seeing small print.
Okay.
And so it's basically a visual symptom, but no pain or no different looking looks of the eye outside,
How does one find out that one has cataract?
Exactly. See, your question is so important because most eye conditions are generally asymptomatic. So our recommendations are for a patient over the age of 40 that have a yearly eye checkup done. Because cataracts, glaucomas, diabetic eye disease, and macular degeneration, these serious diseases, they don't tell you in the early stages that they're there. And early stages when you can correct them much better. So the best thing you can do is check with your eye doctor at least on a yearly basis, especially after the age of 40 or 50 years of age.
Okay. And what is the second most significant disease or?
I would say after the cataract, the thing that we see mostly is glaucoma. But equally significant or prevalent in numbers are conditions like diabetic retinopathy or macular degeneration. Glaucoma is linked to cataract in the from the Indian perspective because we call cataract the Safed Motia and glaucoma the Kala Motia, even though they're two different conditions,
Okay, and why do they call it the Safed Motia and the Kala Motia?
I think because the cataract looks more like a little pearl, whitish, goldish looking pearl in the same size. So that's how it became Safed Motia. For some strange reason, glaucoma became Kala Motia simply because another major condition. But glaucoma is nothing to do with the pearl or motia. It's a high pressure in the eye that does damage to the optic nerve.
Okay. And what are the symptoms of glaucoma?
Glaucoma, again, in most cases, in so-called primary open-angle glaucoma, there's no symptoms at all. Only when significant damage has happened to the vision, then the patient realizes something is going on.
Okay.
But in a very small number of cases of so-called angle closure glaucoma, it may just present as a significant pain and redness in the eye.
Okay. So you're saying that since symptoms are not very obvious, these are kind of like silent killers, and it's important to have checkups every year after you're 40?
Absolutely. That is the best recommendation, especially if you have family history of any of these conditions, and if you have diabetes, and if there's a significant risk factor that you have. You should be checked at least a yearly basis.
And what about for glaucoma?
For glaucoma, mostly you can treat and control with eye drops. There are different eye drops that can control the eye pressure and minimize the damage from the glaucoma. You can never eliminate glaucoma, but you can control it with medication.
Okay.
And sometimes you can use laser or conventional surgery in more advanced cases.
The thought about putting eye drops in my eye every day, or is it daily? Would it be daily?
In daily most
It kind of
cases.
sounds painful, but is it really painful or not really?
It's not. It's more of a, it irritates the eye a little bit, and it takes only about a minute or so out of your 24 hours plus time, So think about it, just like 1 or 2 minutes of irritation in the eye.
Wow.
Yeah.
And thank you. I learned a lot, and I'm sure the audience at home learned a lot. But thank you. I actually became more well informed as just a growing adult about eye surgery, about eye conditions that are out there. But thank you for servicing the Fremont community and, of course, the community at large in the Bay Area over these years with your medical practice.
Thanks, Gil. That's my pleasure. I appreciate you getting me here.
Thank you.
Thank you.